I'm Erin Dahlman-Oeth, and this is The Scoop on Poop. No one wants to talk about poop, whether it be their own or someone else's. The same goes for sharing poop, but rest assured it's for a good purpose. The term fecal microbiota transplantation, or FMT, refers to this idea of sharing stool. It is the process of infusing fecal matter from a healthy individual into an individual who is lacking necessary intestinal bacteria. The idea sounds absolutely disgusting, but it is actually a life-saving treatment for multiple gastrointestinal problems, and it is being researched currently as an option to treat obesity and Parkinson's disease. It is also completely safe based on the most recent reports, and cost-effective compared to the previously used treatments. But the controversy is, should FMT be categorized as a drug or a tissue transplant? For starters, let's recognize what fecal microbiota transplants really are. FMTs fall under many names: poop transplant, stool transplant, fecal bacteriotherapy. However, fecal microbiota transplant is the most common and professionally known name. The process is used to treat gastrointestinal infections like Clostridium difficile, ulcerative colitis, and even constipation and irritable bowel syndrome, or IBS. FMTs, while being useful for these diseases, is most effective against relapsing C. diff because it can replace the good bacteria lost to the infection. C. diff is an infection that usually occurs after a long period of antibiotic use because the drug kills not only the bad bacteria, but also the good bacteria that helps bodily processes. Without good bacteria, the immune system has a hard time functioning effectively, which allows bad bacteria, in this case Clostridium difficile, to move in undetected. This results in diarrhea and inflammation of the bowel, which can be deadly due to dehydration. The normal gut flora is destroyed, allowing the C. diff bacteria to take over the intestinal microbiome by releasing toxins that inflame the colon. The C. diff spores are present very early on, but are latent. The bacteria produce no symptoms and give no hint that they occupy the intestines. An FMT can then help to eradicate the infection by restoring the missing bacteria needed to overcome the Clostridium difficile bacteria. This infection is usually cured with only one treatment, but other conditions, like the gastrointestinal diseases mentioned previously, usually require multiple transplants over a longer period of time. Now you may be wondering how this wonder treatment gets into someone's system. No, it can't be! Swallowing feces! No, this is not exactly the answer. However, one way of infusion, due to a recent innovation in 2009, is in the form of a freeze-dried capsule that is swallowed. Other ways are through an enema, nasogastric tube, nasoduodenal tube, upper tract endoscopy, or colonoscopy. Among these choices, there is no best way of administration. The choice is the patient's preference, although depending on the clinic or hospital, the method of administration may be the physician's responsibility. The next decision in the process is who to receive the feces from. Although the most accessible person would be a family member, this doesn't have to be the only option. One of the rules, according to the FDA's statement on FMT on March 2, 2014, states that the donor must be known by either the patient or the doctor. To maximize safety, the stool and donor are screened for any harmful drugs, pathogenic bacteria, diseases, and other potential problems. Since this precaution started in late 2010, a record of FMTs performed show that no diseases have been transmitted after a total of 370 plus cases in 2011. Another important essential is the procedure of making the material from feces. The amount of feces needed is around 200 to 300 grams, then to be diluted in saline to have the same concentration of the cells inside the body. Research on the use of fresh and frozen feces have shown that neither has any clear advantage. Both are efficient in treating the patient's illness. After that step, the material is blended and then filtered twice to get out the parts that we think of as poop. The end product is an attractive brown liquid that contains the bacteria the intestines want and need. This product is then administered to the patient. To most people, hopefully, this does not sound appealing. Feces don't tend to gain a positive response in general, whether that's due to a neighbor's problematic dog or an ungodly stench in the bathroom. Due to this, you may be wondering, why poop? Why can't you use a piece of tissue from the intestines or some other kind of sanitary material? And that brings us to the benefits of excrement. Reason number 1. Feces are far more accessible than a piece of intestinal tissue. Obtaining a sample of stool is less invasive and therefore safer for both the donor and the receiver. Reason number 2. The bacteria in feces is generally better preserved and has a higher concentration of the target bacteria. The primary types of bacteria that are key for the effectiveness of treatment are bacteroids and firmicutes. Bacteroids help to process large molecules into smaller ones and also prevent pathogenic bacteria, like C. diff, from colonizing the gut. Firmicutes play a role in energy resorption from food and also make up the majority of the gut microbiome. As you can see, these two classes of bacteria are extremely important to continue the normal process of digestion and elimination of waste. Although FMT has mostly been used for these gastrointestinal problems, research has been continuing for its use to treat obesity and to ease the symptoms of Parkinson's disease. Most trials for using FMT to treat obesity have been done on rats, where the gut flora from an obese human was placed in the gastrointestinal tract of one rat and the gut flora of a slim human in another rat. This research is currently being carried out at Washington University in St. Louis by Julia Goodrich, who is heading the experiment. Their team used identical twin humans as donors most of the time to keep the DNA of the two samples of gut flora relatively identical. She told the Dallas Morning News that there were similar clinical trials on humans that produced almost mirror results. Although these outcomes are extremely promising for people suffering from obesity, the more astonishing research is related to FMTs and Parkinson's disease. There have only been a few trials, but the collective results do show that FMTs can relieve many neurological symptoms of Parkinson's disease. A study done by Dr. Thomas Borody accidentally proved this result. When he was testing the effectiveness of FMTs to treat constipation in people with Parkinson's, he discovered that the patient's other symptoms were reduced as well, some even to the point where other observing doctors could not even diagnose their Parkinson's anymore. The cause of this discovery is being tested by Borody soon in another trial using the same variables, FMTs and patients who are constipated and have Parkinson's disease. Some doctors have described the current use of FMTs as the tip of the iceberg due to all the new research on its possible uses. This tip was first touched on more than 1,000 years ago. Therefore, the use of feces as a treatment option is not necessarily a new idea. In the 400 CE, Chinese medical personnel used fecal matter to treat food poisoning and diarrhea. Later on in 1600 CE, a Chinese doctor, Li Shen, used a concoction of dried feces and water called yellow soup to treat patients with gastrointestinal problems. In more recent times, during World War II, German soldiers in the Afrika Korps who were infected with dysentery were sometimes treated with camel feces. This was an experiment German doctors had overheard originally from the Bedouins. From there, the first official procedure of FMT was documented by Ben Eisman in 1958. His experiments showed a rapid recovery rate of patients who had C. diff. Since then, the use of FMTs has steadily gained in popularity, along with some disgust and confusion. But first, the use of feces had to be regulated. To determine how human feces ought to be classified as, the Food and Drug Administration, or FDA, held 2 meetings to discuss the topic, one in February of 2013 and another from March 2nd to 3rd in 2013 also. At the end of March, the FDA started regulating FMTs as a drug. Many organizations spoke out against this because they believed it should have been classified as a tissue transplant. The FDA defended their decision by defining the word drug according to the Federal Food, Drug, and Cosmetic Act. This definition states that a drug is a substance that is used to prevent, treat, or cure a disease or condition and intended to affect the structure or any function of a body. Because of this definition, an FMT was named an Investigational New Drug, or IND, up until March of 2014. On that date, the FDA kept the classification as a drug, but allowed the use of FMTs along with an Investigational New Drug application. This meant that an informed consent, a familiar stool donor, and a screened stool were necessary. Although some complained that filling out an IND application could take weeks, and by that time, it is possible that the FMT isn't needed anymore. Skipping up to more recent times, in 2015, FMTs used for the treatment against C. diff infections no longer have to have a familiar donor. However, if an FMT is used for other infections, an IND application must be used. Part of the FDA's hesitation on this new treatment is due to the safety. In addition to this reason, there are many unknowns regarding fecal transplants. On a microscopic level, not much is known about how FMTs function. Not many clinical trials have been conducted on the use of FMTs for other gastrointestinal diseases, so the long-term effects aren't exactly known. Although this is a win for doctors and physicians regularly performing FMTs, there are still some professionals out there that would classify it as a tissue transplant. These people, like Colleen R. Kelly, a gastroenterologist in the Center for Women's Gastrointestinal Medicine at the Women's Medical Collaborative, first argued the point that a whole stool was being taken from one person and infused into another, which was similar to a blood transfusion or an organ transplant. She says in her article written in the Huffington Post, following the FDA announcement, many doctors who had been performing FMT put their programs on hold, frustrating and disappointing patients, some of whom have even resorted to performing home enemas of donor stool when they were unable to find a physician who was willing or able to perform an FMT. However, she complied with the FDA's standards and regarded all FMT procedures as research. Another advocate for FMTs as a tissue is Christina Campbell, a writer for the international journal Gut Microbiota for Health. She states, "I don't think it is a drug," going on to demonstrate that FMTs can sometimes function as an auto-transplant, meaning a healthy stool from a patient before a procedure can be taken and then re-administered to the same person after the procedure. In this way, it is not a drug. Due to the controversy over the experimental treatment, some people have resorted to performing their own fecal transplantations in the privacy of their own homes. A quick Google search of the words fecal transplant instructions found more than 5 websites that instruct someone on how to do this. Doctors and physicians do not recommend or suggest this by any means. According to one site, The Power of Poop, what one would need to perform this would be the following: an enema bag, a heavy-duty hook, a blender or Ziploc bag, a Bristol stool chart, a diagram of a colon, a strainer, a funnel, distilled water, sea salt, silicone gloves, some kind of lubricant, a towel, tissues, paper towels, a plastic bag, a cushion, and a timer. Just to point out a couple of things in the materials, there's nothing mentioned to sanitize the gloves or any other items, and nowhere does it use the word sterile as a precursor. The chances of infection from the FMT are much higher in a home rather than a hospital or a clinic. This DIY procedure is not safe, although it is understandable that people are seeking help that their doctor can't give them. However, for some, home FMTs have been successful. Using donor stool, these people carefully followed the instructions and understood the procedure to perform it. This only reinforced how relatively easy the procedure is, even though ease of administration isn't the FDA's only concern. As the controversy has died down over fecal transplants, it is becoming clear that it doesn't necessarily matter what the classification is, whether it is a drug or tissue transplant. Although for anyone who wants a clear answer, feces used in FMTs are categorized as a drug. The most important aspect is that it is safely used to treat and cure patients of their diseases. Another significant part is that they are widely available now due to the drop of an IND application by the FDA. New research and old uses have come together to create a cost-effective, safe, and quick treatment for the most debilitating diseases. With the help of the Food and Drug Administration, doctors, researchers, and educators, feces have now gone from being eagerly disposed of to being eagerly collected. This has been Dirty Talk with Erin Dahlman-Oeth, a Domino production. What was that?